New tonight, growing concern about a new strain of COVID-19. Right now, it's in Britain, and officials there say it may be up to 70% more contagious than the current strain.
There are so many unanswered questions right now, which is why CBS 4's Darius Johnson took those questions to local experts as the U.S. is trying to grapple with a pandemic that is now nearing a year.
Britain officials sounding the alarm, prompting a lockdown as other countries close their borders with the new COVID mutation leading to fear. There's still a lot to learn, but here's what health officials are learning months after the strain was first identified.
Now seems to be spreading more, seems to have some changes that indicate that it could actually make it more likely to be infectious.
Dr. Peter Emby, president and CEO at the Regan Street Institute, says mutation is normal in viruses.
We know that viruses mutate over time. Every time they replicate, there's a chance that there could be a change in the code, and so that leads to a mutation.
The mutation is wide-ranging. It can lead to viruses less likely to infect people, make them sicker, or change the behavior of the virus.
Again, there's no indication right now that that new strain makes people sicker, and there's no indication that it actually won't be susceptible to the vaccine, although it's early and we don't really know.
The U.S. has not identified this new strain, but researchers are working feverishly to identify it as it seems to spread quickly.
And if that's true, and if that holds up, then that could lead to a lot more people being infected.
Those who have been vaccinated, healthcare workers are sending a reminder. Do not get your second dose sooner than you should because it may not result in the same immunity boost.
Giving it a little bit later is almost always better. So if you're days or a week later, it would be fine. That's all good.
Reporting in Indianapolis, I'm Darius Johnson.
And as health experts continue to learn more about this new strain, they say stick to the same advice, stay in as much as you can, wear a mask, wash your hands, and avoid large crowds.